Chapter 6, Radiology Administration. The objectives for this chapter will be to provide an overview of the administration of a hospital radiology department and the structure of hospital organization. Describe how the radiology department fits into and complements the hospital environment. Understand the role of the radiology administrator. Describe the functions of management, including planning, organizing, and facilitating, staffing, directing, controlling, coordinating, and project management. Discuss the transition from traditional functions of management to the requirements of managing radiology in the current healthcare environment. Describe regulating radiology and discuss the characteristics of desirable applicants for employment in radiology. When you think of a hospital environment, you have to think of the hospital like a community within a community. A larger hospital here in the Dallas-Fort Worth Metroplex can literally be larger and have more people present on a day-to-day basis than some of the outlying cities around the Metroplex. You can have thousands of patients, and for every one of those patients, there can be 5 to 10 people that participate in their care every day, even more than that. So you have large numbers of people 24 hours a day, 7 days a week, 365 days a year present in these facilities. And as a result of that, there are lots of support services that are in place, just like there are in cities. Most hospital districts have their own police department. They have their own fire control folks. They have the folks that handle the facilities and make sure that everything is working in the facilities. Engineers that make sure that there's plenty of water pressure. Electrical engineering that makes sure that the day-to-day power is working, and then make sure that there is backup power in case of an emergency or the grid goes down. You've got to be able to continue to provide electrical power for folks that are on ventilators, for example. And so there are lots of support folks making sure behind the scenes that that city, that community within a community continues to function. You have to be able to feed all of these people. You have to be able to take care of the sanitation of the people. You have to be able to take care of the housekeeping and maintaining infection control in these areas. So it really is like a city. And that hospital city serves the community in need. You have hospitals that are funded and supported by taxes that folks in the county pay. You have hospitals that are funded by different organizations, religious organizations, that help provide funding for those. And then obviously there's reimbursements that come from the federal government. But all of these things combine to make sure that for any patient that's present in the hospital, their healthcare needs can be met, as well as their emotional and social needs can be met. You can look at any healthcare system anywhere in the United States, and one of the first things that you will see on their website is their mission. That mission statement defines their purpose. Why are they here? And it also serves as a guide for how they want to interact with their community of need. How are they going to serve their community? And one of the key things and one of the key roles of the administration of the hospital is make sure that all of the staff are committed to that mission, that everybody is in agreement with what the mission is, and everyone understands their role in accomplishing that mission. All the decision making, all of the directives, all of the projects that may be going on within that hospital should directly support that mission. And then in addition to the mission statement, you'll also see a vision statement. And to me, the vision statement, your book says it defines what the organization wants to achieve over time, but it also, I think, speaks a lot about what the expectations are for the culture of the hospital and the culture that the employees will exhibit as they work with their patients. So I've got a couple examples here. I've got one for Baylor Scott and White, and I've got another one for Texas Health Resources. They're a couple of the larger healthcare systems here in the Metroplex. And for example, for Baylor Scott and White, their mission statement says that they were founded as a Christian ministry of healing. Baylor Scott and White Health promotes the well-being of all individuals, families, and communities. That's their mission, to promote the well-being of all individuals, families, and communities. Their vision is to be the trusted leader, educator, and innovator in value-based care delivery, customer experience, and affordability. And their values: we serve faithfully, act honestly, never settle, are in it together. So you can see the mission is the bigger picture. The vision is drilling down to specifically things that they're going to focus on: be an innovator in value-based care, be an educator in value-based care, value-based care delivery, customer experience, affordability. Those are when they think about the projects or the directives that they're going to do, they're guided by the mission, but the vision is those specific things that they're going to focus on. And in the values, to me, like I said, that gets down to the employees, the people that are there. This is the culture that they believe in, and this is the culture that will drive everything that they do and how they treat their patients: to serve faithfully, to act honestly, never settle, and we're in it together. So there's an example of one mission, vision, and value statement. Here's one for Texas Health Resources. Their mission is to improve the health of the people in the communities we serve. So you can see both hospitals in that mission statement, their focus is on the people in the communities that they serve. It may be stated differently, but that's the overarching mission of the hospital, is to take care of, to improve the health of the people in the community. Texas Health Resources, their vision is to partner with you for a lifetime of health and well-being. So basically what they're saying is, we're going to be here with you through your life, from the beginning to the end. Anytime you need us, we're here for your health and well-being. You don't have to go anywhere else. And their values, part of that culture of Texas Health Resources, is respect, integrity, compassion, and excellence. If you look back at the one for Baylor, you hear some of those same words: the integrity, honesty, compassion, excellence. We're in it together. We're not going to settle. A lot of the same ideas in mission, vision, and values. You can look at any corporate website in the United States, and they're going to have mission, vision, and value statements, because that's just part of the norm now, and this is part of the decision making that takes place at the higher levels of administration in a hospital or any corporation. The organizational structure can vary from one hospital to another. Sometimes that organizational structure is driven by the mission and the vision. You're going to have a board of directors or governing board, typically made up of folks that are from all walks of life, decision makers usually at a fairly high level in whatever companies that they work for. The president or CEO is accountable to that board. So they answer to the board. Ultimately, the board makes decisions with the guidance of the CEO, but they ultimately make the decisions, and the CEO is accountable to them to make sure that those decisions are carried forth. And then underneath the CEO, all the different divisions and departments are going to line up to or answer up to in the chain of command to the CEO. The CEO of a hospital is going to have usually a background in business management, things like that. They're not usually a physician. There is a medical director that sits in the org chart at the same level of the CEO, but that medical director is who all of the physicians answer up to and then the medical director and the chief executive officer together make sure that all of the policies and procedures in the hospital are being followed. In your book, there's about 3 different uh, organizational structures. I've put a few of them here in the slide for you to kind of look at so you can see what I'm talking about when I talk about how things are lining up or across. When you see a solid line in an organizational chart, that means that those folks are direct reports. A chief operating officer reports directly up to the president and the CEO. The president and CEO answers directly to the board of directors. When you see a dotted line, that means that they report to them, but they also have similar decision-making power. So you'll hear that when you hear about org charts as a straight line report or a dotted line report. But in this particular type of organizational chart, you've got a VP in different areas, and then they typically are going to try to put similar areas underneath that vice president of nursing services, for example. If you work in med-surg, you're going to answer to the VP for nursing services. If you're in pharmacy or occupational health, on this particular org chart, the VP of support services would be your direct report. Labs, radiology, it's a decision that's made jointly of how these are going to break down, and they may not be the same in any 2 hospitals, but this is how they line up. And so as an employee, as somebody that works in radiology, it's good for you to know who's your direct report. Your director is going to report to the COO. If you're part of the School of Rad Tech, or if you're working in medical education, then there might be a vice president of education that they're going to line up to. You can see a lot of these services underneath this VP of education have to do with training, with teaching, with learning. You don't see too many of these education VPs of education much anymore. Some hospitals have education liaisons, but they're probably not going to be a VP that just functions over the education. Another type of, in medical imaging, we work closely with all departments in the hospital, and so you can find us in a lot of different places in the organizational chart. But when you think about the departments that we come in contact with, it's hospital wide, with nursing, with surgery, with the emergency department, with labs, with pharmacy, with nutrition. All of these areas, we're going to interact from time to time with them. One of the trends that we're seeing now in healthcare and in the hospitals and the organizational structure is that they're becoming more horizontal as opposed to top heavy. When you have a horizontal organizational structure, you have less levels to go through if there's an issue and if you need a decision made. So it's less top heavy and puts the decision makers closer to the employees. In the last few years, reimbursement has been shifting from inpatient to outpatient. This is one of the reasons that you saw so many freestanding ERs popping up all over the United States. It almost got to be comical. There was always a Walgreens on one corner and a CVS on another, and then all of a sudden you've got this freestanding emergency room on one corner and another freestanding emergency room on the other corner. And this was because some changes had been made in reimbursement and how emergency room procedures and visits could be reimbursed. Another reason we saw that is because wait times in the emergency room had become so long that it was becoming a huge issue in being able to deliver care to patients that really did need it. Lots of folks were using the emergency room as their primary care physician. I don't have a doctor, I don't have insurance. I'm just going to go there because I think I've got the flu, or I'm going to go there because I've got a rash on my arm, when that's not really what the emergency department was meant for. But by creating these freestanding emergency rooms, some of those same folks could go there as opposed to tying up an emergency room at a hospital that's a level 1 trauma center. Now, what we have seen in the last year or so is that there's been a shift in that funding, and now you're seeing a lot of those freestanding ERs are now closed. So it's not unusual to see these cycles of change that happen, and a lot of times it's driven by how the federal government reimburses the hospitals for the care that they provide to their patients. Hospitals cannot deny a patient service, whether they have money in their pocket, a credit card, or whether they have insurance. They can't deny care to a patient. They're still going to try to get reimbursed. They're still going to try to get paid for the service they provide, because it costs money to treat patients. It costs a lot of money to treat people. And one of the reasons we try to encourage people not to go to the emergency room unless they truly have an emergency is a portable chest x-ray taken, or a chest x-ray, let's just say, taken in the emergency room costs more than a chest x-ray that you might get taken at your doctor's office. The amount that they will reimburse that is not necessarily the same. And so ultimately, the cost gets passed on to the patient. And that's true for anything. If you go and you just have a rash and you go to the emergency department, the bill that you might get for that might, let's just say, might be $1,000. But if you go to an urgent care and have that same thing, it might be $300. And if you see your primary care physician, it might be $150. Because those facilities, their level of care is higher when you think about an emergency room or an urgent care or a PCP, the cost for them to do business is higher. And so that cost gets passed on to the patient. So we see these trends in healthcare. When reimbursements start going down, numbers start going down in the departments, and you may not have as many patients. And then when we have the ability to have healthcare and insurance for people, and they have the ability to get primary care, and they have ability to have wellness exams, then that increases the opportunity for us to participate in that care for a patient. So here's one of those top-heavy org charts I was talking about. So you have, we can just say that this is like a CEO, and this is a vice president level. Well, now here's another level of administration under them, and then here's another level of administration, and then here we are, the worker bees down here. And so if there's an issue that has to be decided on, this person has to talk to this person, might have to talk to this person before ultimately this person makes a decision. And so that type of a vertical organizational structure that's top heavy can really slow down the ability to make quick decisions or quick changes in processes that would make things better, possibly, for how a department is running or how patients are receiving care. When you make the organizational chart flatter or less top heavy, here's those same worker bees. Here we are working in the radiology department or the lab or surgery, and now we have one person here that's an administrator, and that one person only has to come over here to verify whether or not this idea, this decision is a go or a no-go. So the less layers that you have between that ultimate decision maker, the better. Another kind of newer, more modern type of org chart that's out there is called a matrix org chart. It's sort of grouping those decision makers based on their departments, but it also allows the person in charge of lab to directly converse with the folks in outpatient, with women's services, with outpatient surgery or pediatrics. So you have more of a what are their needs, grouped by their needs, and then they have access across the board to all these different areas. Again, uh, there's not as many layers. This one has more to do with how the services are grouped. It's still fairly horizontal in terms of the decision making because you've got one level here and one level here. Board of directors is always at the top though. Ultimately, the yes or no, the decisions, the processes are going to be determined by the board of directors, and then the president, CEO is going to implement those. So what about inside the radiology department itself? Is there an organization? Absolutely. There's a chain of command inside the radiology department, just like there's a chain of command in the hospital. And as an employee, it's really important that you understand that chain of command. You should never hop over your first line of report uh, to try to get something done. You really need to follow that chain of command because a lot of times as employees, we don't know everything that's going on in the background. Something may not make sense to us and we think, oh, this is wrong. We need to go over somebody's head. But, we don't always have all the information. So in the radiology department, we always have a director of the department. Sometimes they're folks that have a background in imaging. Sometimes they don't. There's different philosophies about that. Some people say, they would rather work for somebody that has a background in radiology. But ultimately, when you get to this level of organization, when you get to this level of the type of decisions that have to be made, you need someone that's a good leader. You need someone that's a good listener. And you need someone that can look at the big picture and make decisions that are going to be best for everybody, for the employee, for the patient, for the organization. And the organization chart in a radiology department is going to vary depending on the size of that department. If you've only got 3 people working in that department at an imaging center, you may not have a direct report to a radiology director. There may be a center director that's over everybody there. But it's going to depend again on the size and the scope. In a large hospital around here, there's going to be a director that sits in the radiology department that works directly with the radiologist and then works with the employees in the radiology department, all those technologists. Inside the radiology organization, we're going to have sub-departments. You've got diagnostic radiology. You've got the emergency departments. You've got CT departments. You've got the MRI department, the sono department, the nuclear medicine department, vascular interventional department. You have a lot of sub-departments that all fit under the umbrella of the radiology organization, and they all typically will answer up to that director. So that person is responsible for the daily working and operation of each of those sub-departments. And then those support services are also involved in what we do. You've got medical records that directly works with us. You typically are going to have some administrative assistants that work in the department that help with patients, with checking patients in and things like that. Making sure medical records are up to date, lots of different support services. So all of those things have to work together in the radiology department to make sure that we can provide the best care to our patients. So I mentioned some of this already. The person that is the director of radiology reports up to probably a vice president, administrator in terms of their direct report. They definitely need strong business management skills. A big part of how a department at a hospital is evaluated is by their patient satisfaction scores. Every hospital and a lot of doctors' offices send out surveys to their patients asking what their experience was like because as they say, you have a choice. You can, if you don't like the way you're treated at this hospital, you'll go to a different hospital. If you don't like the way you're treated at Imaging Center A, then the next time you need a CT scan or an MRI done, you'll go to Imaging Center B. And so they want to have that lifelong commitment, like THR talked about, of being your healthcare provider. And one of those things that that department looks at is those scores on those patient satisfaction surveys. Uh, the couple of different hospitals that I've worked at, I mean, the director would put those scores up on the bulletin board in the break room where everybody could see how were our scores in diagnostic x-ray, how were our scores in CT, how were they in MRI. And if they were dipping below what they deemed acceptable, then there was going to be some action taken. You know, there might be some need to retrain the employees to help them understand keywords and terms and things that patients want to hear from you as their healthcare provider. Um, so that understanding of business, understanding management, understanding how to lead people to provide the best service possible is a key skill set for anybody at a director level. And I mentioned they're not necessarily a rad tech. They're not necessarily going to be somebody that's worked in radiology before. I've been in departments where I had a director that was a rad tech, and I've been in departments where uh, I had a director that had more of a facilities background. Bottom line is, do they understand how to work with people? Do they understand business? And can they lead and help us meet the mission and the vision of the hospital? And they're going to work real close with the medical director for radiology, because if the medical director of radiology isn't happy, nobody's going to be happy. So we have to make sure that we are providing the radiologist with the most optimal images that we possibly can. And if those radiologists start to see a decline in the quality of imaging, they're going to talk to that director, and then that director's going to talk to the techs. I mean, that stuff rolls downhill. And so we all want to do our best all the time to keep everybody happy. The medical director, on those first org charts, you notice they were sitting up at the top. They dotted line over to the CEO and to the board. They're typically going to be responsible for the quality of patient care, and also the physicians that work in the hospital will also line up to them. They're going to work closely with the administrative director in a department, whether it's the radiology department, whether it's the basic hospitalist that covers everything, that work all over the hospital. They're going to be their primary administrative person. And we always think of um, imaging services and things like that being more of a hospital-based kind of thing. But nowadays, especially with the emergence of digital imaging and the equipment that's needed, it's much easier now to have imaging available in clinics, outpatient center, mobile imaging services. I mean, there are portable X-ray machines that are much smaller now that can actually be put in the back of a minivan and taken directly to where a patient might be. These are used a lot in assisted living centers and long-term care centers where it's not really feasible to bring a patient to the hospital or bring a patient to a doctor's office or imaging center. And so we're able to bring the imaging equipment to them. And also in outpatient surgery centers and urgent care centers that I mentioned before. But then there's other types of facilities that have popped up now that have imaging services, commercial facilities, walk-in clinics, research centers. You don't always think about universities and research centers utilizing imaging, or veterinary medicine. We have lots of students that come through our program that have a background in veterinary technology. They've been techs at vet offices and actually seen x-rays and used x-rays for the care of animals. Zoos, for examples, oftentimes have imaging departments up to a certain point. If they need something bigger, they might bring those animals to a hospital. I've read articles about that happening before. And one of the newest things on the scene that's probably been in the last 15 or 20 years as the internet has become more robust and bandwidth has increased and speed of internet has increased is teleradiology has become a huge part of any uh, radiologist job, but also services. I mean, back in the day, a hospital that's open 24 hours a day, somebody had to work that third shift. Well, now um, we can have those x-rays that are taken in the deep night here in the United States read in another part of the country where that's daytime. And so that way you've got people available around the clock all over the world that can look at those images. Uh, Not only teleradiology services now, but just telehealth, being able to, if you've gone to the doctor at all in the last 6 months, you may have had to have a visit with your doctor through your webcam and your phone and talking about what your symptoms are and what's going on and then making a decision based on the information that you could provide at that time because it wasn't feasible for us to all walk into a doctor's office right now. So things are constantly changing in healthcare, and uh, you really have to be able to shift with that and to learn new ways of doing things and thinking outside the box as far as how we can accomplish what we need to do in these various settings. If you decide you want to get into management, which a lot of our students do, they start out as a technologist, they go on and get their bachelor's degree, then they go on and get a master's degree, typically an MBA or maybe a master's degree in hospital administration. Um, and with that knowledge, that puts them in a position to do the type of planning that has to take place to run a department, the organizing, facilitating, to make sure that those processes that have been put out there are actually being done. How do you hire the right people? Coaching employees. That's really important to be able to look at your team and say, I know that at some point in the future I'm going to need a new lead tech. Who do I have waiting in the wings that has those skills that's going to be able to step up and take on that role as a lead tech? And then controlling and coordinating those performance standards, looking at those Press-Ganey or those patient satisfaction scores, and helping the team understand what their unified purpose is so that we provide the best health care we can for our patient. You've got to be able to communicate, whether it be through email or phone or Zoom meetings or one-on-one with your staff. You've got to have good communication skills. And probably the most important trait is, as I've said time and time again, is leadership skills and being able to coach your staff, to coach them up, to help them be better and be the best team member that they can be. A big part of the job of a hospital administrator or a radiology department director is process improvement. You're constantly having to look at how you're doing, how is the department doing, how's the bottom line. It's not just patient satisfaction scores, but cost, managing the shift. Do you have 8 people working when you really only need 6? Being able to look at all of that and constantly and continuously evaluate it and put into place new processes that will allow the organization to better function. But ultimately, customer service is the focus. All of those decisions, the CQI, continuous quality improvement, total quality management, TQM, all of those processes ultimately should be driving customer service and to provide the best customer service. And one of the quotes that I always like is doing things right the first time, meeting and exceeding the customer's expectation. If you do that, then you won't ever have to worry about what your customer satisfaction scores are going to look like. If you do it right the first time and you meet and exceed what they expect from you as a caregiver, then you're not ever going to have to worry about that. But process improvement is a big part of what a director of a department does, or a CEO of a hospital, or the board of directors. Those folks that get up into the administration levels, they're constantly looking at how we can do better. Regulatory activities go on in a hospital just like they do in a city or any other agency. We have internal regulations, but then we also have external ones. Food and Drug Administration is a big part of what determines what we can and can't do. Medicare, Medicaid, those are regulatory activities or agencies. As it says here, they're often performed by committees or governmental agencies. A lot of times we have voluntary type regulations, but there's also the possibility that those are going to be mandated. So there's lots of, I guess you could say, lots of regulations that go into the day-to-day operations of healthcare, and folks that work in administration have to be familiar with those and know how to implement them. Some of the external agencies that we deal with on a regular basis in the radiology department, number one is the Joint Commission. The Joint Commission is an organization that accredits hospitals. Just like we talked about our radiography program being accredited by the JRC-ERT, the hospital is accredited by an organization called the Joint Commission. They have a set of standards. There is an expectation that the hospital is going to meet those standards. And there's a year-long process that goes on behind the scenes when it's time for the Joint Commission to come visit the hospital and determine whether or not they still meet those accreditation standards. And that year-long process is literally a gathering of data, of information, things like that that the Joint Commission requires and will evaluate. And then they actually come to the site for a visit. And they look to see if what you told them on paper is what's really happening in the hospital, all the way from the top down. They visit every department. They talk to the employees in all those departments to find out how the hospital is operating, how patients are being treated. Nuclear Regulatory Commission. If your hospital has a nuclear medicine department, they are regulated by the NRC, and you cannot have radioactive isotopes not accounted for. And that's a big part of what the NRC is looking at, as well as the safety measures that go along with having radioactive isotopes. OSHA is a federal government organization that covers all occupational safety and health administration. You've heard of OSHA before. The FDA. Most pharmaceuticals are regulated by the FDA. The American College of Radiology. For our radiologist, the ACR is one of the primary organizations that helps establish protocols for exams that are used in imaging, for the training that the radiologists are required to do, those types of things. And then every state has a health department. In Texas, it's called Department of State Health Services, but also the TMB, the Texas Medical Board, is involved in what goes on at the hospitals. The physicians that work there all have to be licensed by the Texas Medical Board. As a medical radiologic technologist, you have to hold a license from the Texas Medical Board. Just like you have to pass that ARRT exam to be a registered radiologic technologist, or a registered technologist in radiography, you also have to be able to meet the criteria to successfully obtain a license from the Texas Medical Board. So in Texas, both of those things are required to practice. Inside the hospital, There's always going to be opportunities for you as an employee to get involved with committees if you're interested in that kind of work. There's always an infection control committee. We're always looking for ways to cut down on infection rates in a hospital. You know, we don't want a patient to come in that's not sick and come in for a surgery, and then after that surgery's done, suddenly they've got an infection that they acquired while they were at the hospital. Those are called nosocomial infections. They literally acquired it while they were in the hospital. And so we do everything we possibly can to control those types of infections. In situations like we're in right now where we've got a pandemic going on, that infection control committee is constantly evaluating the information that's out there about that particular virus and adjusting on the fly to how we control that infection inside the hospital to make sure it's not transmitted from patient to employee, from patient to other folks that are working in the hospital, besides just the x-ray techs and the nurses. For the radiation department, we have a radiation safety committee that's constantly evaluating practices, making sure that we're meeting the requirements of ALARA as low as reasonably achievable. Safety committee, when you've got people working in a facility 24/7, 365 days a year, the potential for someone to get hurt is fairly great. And so the safety committee is always looking at processes that are in place and making sure that those processes provide a safe work environment and that people are reminded of best practices for in order for them to safely complete their job. You know, for us in the x-ray department, probably one of the most common things that we have to be careful about is slipping on a floor if there's something gets spilled. Also using proper ergonomics when you're moving patients, lifting, pushing, pulling, all those things so that we don't hurt our back. And so lots of reminders out there. You know, sometimes there's posters and things up to remind you about how to safely do your job. And then all the other, you know, pharmacy, therapeutics, the PACS committee works with the radiologist and the technologist to decide how do we best move these images from the room to the computer, from the computer to the radiologist. How's the most efficient way to make sure that these images are being stored and are moving across the network securely. So one of the things we mentioned and one of the things I talked about when we talk about your role as a radiology administrator is being able to hire the right person for the job. And when we talk to radiology directors in some of our clinical sites and ask them, you know, what are the most important characteristics? These are some of the things that come out. And this is true anywhere, you know, especially in our field though, because our technology is constantly changing. We're so reliant on computer technology. And how those computers communicate now is constantly changing. So you've got to have strong technical skills. You've got to be comfortable working with a computer. You've got to be comfortable working between 2 to 3 software platforms at a time because we have a patient's chart in one type of software. We've got the patient information system that has to do with billing and how we have to complete an exam so that the folks in the billing department know that somebody's got to pay for that exam. And then we've got the PACS system where we have to make sure that that exam is attached to the right patient and then it's sent over to the radiologist. So you've got to be able to work. That's just moving the images around and dealing with the patient's paperwork, so to speak. But then you've also got lots of different types of equipment, all of which are computer operated. And so you've got to be comfortable working with all different kinds of systems. And you absolutely have to have good teamwork skills. I mean, we are a team. We're part of the healthcare team. We're part of the patient care team. And then inside the department, we support each other and help each other. If you need help moving a patient, you've got to stick your head out the door and say, hey, I need some lift help over here. And anybody that's not currently with a patient is gladly going to come and help you because they know you're going to help them when they need help. So we are a team and we support our team members. And you've got to be a person that works well in that kind of environment. You've got to be customer service oriented. Some of our best students are students that have backgrounds in other fields outside of healthcare, but dealing with customer service, knowing how to talk to someone, know how to de-escalate a situation, being able to make sure that that patient is treated the way that they should be treated and receive the care that they should receive while they're there with us in the department. Good communication skills with patients, with your coworkers, with the physicians that you have to work with, the radiologist. You've got to be able to communicate professionally and appropriately at all times. You have to conduct yourself like a professional because you are. Radiologic technologists are professionals in the imaging department, and you should conduct yourself as such. And you absolutely must have a good work ethic, because I go back up to that second one. If you don't have a good work ethic and you don't show up for work on time, or you just don't show up and you don't call in, well, that person that's working the shift before you, they may not be able to leave until you show up or until they get a replacement in there, because we've got to have a certain number of people on every shift in order for the department to function appropriately. And so having a good work ethic is imperative. And all of these things that you see here, these desirable employee characteristics, are also desirable student characteristics for students that want to get in the program and for students that are in it. Because when they step on that clinical floor, when you become a student in our program or any radiologic technology program, and you step onto that clinical floor for that first time, there's going to be an expectation that you are going to have those characteristics. And when you're a student in the clinical environment, every day that you're there is a job interview. Every day that you're there, those technologists are watching you interact with patients. They're watching how you handle the technology. They're watching how you get along with the other members of the team. Do you fit in or do you not fit in? Do you have good communication skills? Do you have a professional attitude? Do you show up every day with scrubs that are clean, that don't look like they were in the dryer all night and wrinkled up, and you throw them on like you don't care? All of that stuff makes an impression on people. And as a student, are you on time? We have a saying that to be early is to be on time is to be late. You've got to plan ahead and know that you might walk in there, and if you walk in literally at the time you're supposed to clock in, there may be somebody else 3 people deep at the clock in, and you're standing there while everybody else clocks in, and you may be late because you weren't there early enough to take into consideration those kinds of situations that arise, or traffic, or whatever. So all of these skills are super important, and every day that you're at clinic, you're being evaluated as a potential employee. Because most directors would rather hire a student that's been working with their team, that understands the mission and the vision of the hospital, that gets along with everybody in the department. They would much rather hire somebody that they've had their eyes on for 6 months or a year than some random person that submitted a resume that looks great on paper, but you have no way of knowing how are they actually going to be once they get in there and become part of the team. So it's really important as a student that you always put your best foot forward. I can't stress that enough. And so in conclusion, radiology administration, I'm sure you can tell from looking at all this, is very complex and very demanding. The thing to keep in mind, the higher up you go in administration, the farther you get away from taking care of patients. And so you have to decide where your passion is. What are you most interested in? What are you going to be happy doing? If you really, really love working with patients and that level of work, if you start climbing up the administration ladder, you may find that yes, you're moving up and getting a title and you're making more money, but you're getting the farthest away from what you really love doing. And you've got to think about the payoffs and the pros and cons of making a decision like that to move in that direction. Uh, as a hospital and a healthcare provider, we're very customer focused, as are most service industries. Um, you may work with external and internal agencies and committees and have to be able to put processes in place to meet the requirements of those organizations. And as a medical imaging employee, you've got to have strong technical skills and really good teamwork skills.